Hey everyone, and welcome to our channel. Today, we're diving into the world of chia seeds. In this video, we'll also discuss some potential side effects of chia seeds and things to be aware of. So, let's get started and find out if chia seeds are worth the hype. 1. Digestive issues. High fiber content is a well-known benefit of chia seeds, but for those not used to a fiber-rich diet, it can cause digestive discomfort, such as bloating, gas, and abdominal cramping. Eating too many chia seeds in a short period can overwhelm the digestive system, especially for individuals prone to irritable bowel syndrome or other gastrointestinal issues. To avoid digestive problems, it's crucial to introduce chia seeds into your diet gradually and to drink plenty of water. This will help the fiber pass smoothly through your digestive system. 2. Risk of choking. Chia seeds absorb many times their weight in water, expanding into a gel-like consistency when exposed to moisture. While this is what makes them great for thickening smoothies and puddings, it also poses a choking hazard, especially if the seeds are consumed dry. They can easily become lodged in the throat, especially if not properly hydrated. Always soak chia seeds in water or another liquid before consuming them. If you're eating them dry, do so with caution and plenty of water. 3. Allergic reactions. Though relatively rare, chia seed allergies do exist. Symptoms can range from mild itching, skin rash, to severe anaphylaxis, which can be life-threatening. Individuals allergic to other seeds, such as flax seeds or sesame seeds, may also have a higher likelihood of being allergic to chia seeds. If you suspect an allergy, discontinue use immediately and consult with a healthcare provider. 4. Interaction with blood pressure medications. Chia seeds are rich in omega-3 fatty acids, which have a natural blood-thinning effect. While this can benefit heart health, it can pose risks for individuals on blood-thinning medications or those with naturally low blood pressure. Consuming large amounts of chia seeds may amplify the effects of these medications, potentially leading to excessive bleeding or dangerously low blood pressure. If you're on blood pressure or blood-thinning medication, consult your healthcare provider before adding chia seeds to your diet. 5. Blood sugar imbalance. Chia seeds can help stabilize blood sugar levels, making them a popular choice for people with type 2 diabetes. However, when consumed in large amounts, they can lower blood sugar too much, leading to hypoglycemia, low blood sugar. This is especially problematic for individuals on medications designed to lower blood sugar. Monitor your blood sugar levels and consult with your doctor if you're incorporating chia seeds into a diet designed to manage diabetes. 6. High in calories. Despite their small size, chia seeds are relatively calorie-dense, with around 137 calories per ounce, about 28 grams. While this is not an issue for people consuming chia seeds in moderation, those adding large amounts of chia seeds to smoothies, yogurt, or salads should be mindful of their calorie intake, as it can contribute to weight gain. Stick to recommended serving sizes, which are typically around 1–2 tablespoons per day. 7. Omega-3 overload. Chia seeds are an excellent source of alpha-linolenic acid, a type of omega-3 fatty acid that is beneficial for heart health. However, consuming large quantities of ALA may increase the risk of certain health issues. Some studies suggest that high levels of ALA may be linked to an increased risk of prostate cancer, though the research is not yet conclusive. While omega-3s are vital for health, balance is key. Stick to moderate portions of chia seeds and ensure you're not overloading on ALA from other sources as well. 8. Interference with medications. As chia seeds can influence blood pressure and blood sugar, they may interfere with medications designed to control these conditions. Chia seeds' blood-thinning properties can also impact medications like aspirin or anticoagulants, potentially leading to unwanted side effects such as excessive bleeding. Always consult with a healthcare professional if you're on medications and considering adding chia seeds to your diet. 9. Gastrointestinal bloating and gas. The high-soluble fiber content in chia seeds can be a double-edged sword. While it promotes healthy digestion for many, it can also lead to gas, bloating, and stomach discomfort in others, especially those not accustomed to high-fiber foods. The seeds absorb water and swell in the stomach, which can cause feelings of fullness or bloating. Increase your chia seed intake gradually and drink plenty of fluids to help the fiber move through your digestive system. 10. Risk of kidney stones. Chia seeds are high in oxalates, compounds that can contribute to the formation of kidney stones, especially for those who are prone to the condition. People with a history of kidney stones should be cautious about consuming large amounts of chia seeds regularly. Limit chia seed consumption if you have kidney issues or are prone to developing stones. 11. Prostate cancer risk. As mentioned earlier, chia seeds are a rich source of ALA, which has been associated with a higher risk of prostate cancer in some studies. Though the evidence is not definitive, some health professionals recommend limiting ALA intake until more conclusive data is available. If you are at high risk for prostate cancer, consult with your doctor about your chia seed intake. 12. Exacerbating pre-existing digestive conditions. For individuals with pre-existing digestive conditions, such as Crohn's disease, colitis, or diverticulitis, the high fiber content of chia seeds can exacerbate symptoms like cramping, diarrhea, and inflammation. If you suffer from digestive conditions, it's best to discuss chia seed consumption with a healthcare provider before adding them to your diet. 13. Dental problems. Because chia seeds tend to swell in liquid, they can easily get stuck in your teeth, leading to discomfort or potentially contributing to dental issues if not cleaned out properly. Their tiny size also makes them more likely to hide in hard-to-reach areas of the mouth. Make sure to rinse and brush thoroughly after consuming chia seeds, especially if they're part of a drink or pudding. 14. Nutrient imbalance. While chia seeds are nutrient-dense, relying too heavily on them in your diet could potentially lead to a nutrient imbalance. Chia seeds are high in omega-3s, fiber, and antioxidants, but they are lacking in other essential nutrients such as vitamin C, iron, and some B vitamins. Overemphasizing chia seeds in your diet at the expense of other food sources can lead to nutrient deficiencies. Ensure you're consuming a balanced diet that includes a variety of nutrient sources. 15. Hormonal imbalance. Although chia seeds are not inherently hormonal disruptors, consuming excessive amounts of omega-3 fatty acids has been suggested in some research to potentially influence hormonal balance. For example, excessive omega-3 intake might affect the body's balance of omega-6 and omega-3, which could disrupt normal hormonal functions over time. Keep your omega-3 intake in check and consume chia seeds in moderation to maintain hormonal balance. So there you have it, folks. Chia seeds can be a healthy addition to your diet when consumed in moderation. They offer a good source of fiber, omega-3 fatty acids, and protein. However, it's important to be mindful of potential side effects and to consult with a healthcare professional if you have any concerns. Thanks for watching. If you enjoyed this video, please give it a thumbs up and subscribe for more health and wellness content. Don't forget to leave a comment below and share your thoughts on chia seeds. See you in the next one.